What are the chances that you have diabetes and have absolutely no idea that you have it? The very fact that you're watching this video means that you live in a modern enough society and you probably eat enough of a standard Western diet that there's actually a very high likelihood that you have diabetes or prediabetes and you have no idea. How is this possible in a modern society? In this video, I'm going to explain this to you, break it down, and at the end of this video, I'm going to tell you the lab tests that you need to have checked so that you know for a fact, yes or no, are you diabetic, are you pre-diabetic or not? I'm Dr. Ken Berry, a family physician with 20 years of clinical experience, and this video is going to help you understand whether you have hidden diabetes or not. Now, you may be thinking, hey, I'm very young, I'm very slender, I feel great every day. It's impossible. There's no way that I have diabetes or prediabetes. Au contraire, it's very, very common for people to have the early stages of diabetes, prediabetes, and still be slender. It depends on your genetics. There are populations who immediately start to gain weight and become overweight and obese if they're moving down the road towards diabetes, but there are many genetic populations who do not express hyperinsulinemia and chronic inflammation and chronic carbohydrate toxicity as obesity. We all have a different personal fat threshold, and you may be a skinny diabetic. You may be a young diabetic. You may be a very healthy, vigorous diabetic and have no idea. Yeah, that's possible. There are really two ways that this happens. The most common way is that you just haven't been to the doctor. You're in your teen years, your 20s, your 30s, you feel young, you're slender, you're healthy, you don't think you have any problems. You're able to eat pretty much whatever you want and keep your figure, keep your waistline. And so therefore you think that means that it's impossible for you to be pre-diabetic or diabetic. And that's just not the case. It's very, very common when you get the labs I'm going to tell you about checked at the end of this video that you're already pre-diabetic and you had no idea. Or worse yet, you're diabetic and you were walking around letting this diabetes damage your body permanently and you just didn't know. Now, the second way, and it may be a little less common, but it's much more just unforgivable. Is that you've been to the doctor and your doctor checked all your labs and said everything was normal, but you still have diabetes. How is that possible? Let me explain. Most doctors, when they see you for just a well-person checkup or an annual checkup, they check a very limited amount of lab work. They'll check a basic metabolic panel. They'll check a lipid panel. They'll check a urinalysis. They might check a complete blood count, and they maybe check a magnesium and a phosphorus, but usually not. And so with that set of lab work, you can be a pre-diabetic or very, very diabetic and have a normal blood sugar. Because in all that lab I just described, there's only one test that would even hint at whether you're a diabetic or not. And that's a fasting blood sugar. It's very, very common for someone with prediabetes or type 2 diabetes to have a normal fasting blood sugar. Yeah, that can happen because you haven't eaten for 8 to 12 hours. Your blood sugar, because you're fasting, can return back to normal. And so if all your doctor checks is that limited set of labs that I just said, then the only indicator of diabetes is that your fasting blood sugar and it was normal. Also, if your blood sugar is over 180 to 200, then you'll spill some glucose into your urine. And so then your urinalysis, which most doctors will check on your annual checkup, it might show some glucose in your urine. But if your blood sugar is 179, you don't spill any into your urine. Therefore, again, your doctor is blind to your diagnosis of prediabetes or diabetes. Let me tell you about the two tests that you either need to demand from your doctor, and I don't care how old you are, how slender you are, how seemingly healthy you are. If you're over the age of 10 or 11 years of age, you need these labs checked at least once a year if you're eating a standard Western diet, a standard American diet. They are, number one, a hemoglobin A1C. Now, in the U.S. and most parts of the world, it's measured at like so. You want a normal value, which is under 5.7. So if your value is 5.6 or less, then we're going to consider you normal. If your level is 5.7 to 6.4, sorry, my friend, you're a pre-diabetic. Yeah, and some people are saying that we really should call this early diabetes, not pre-diabetes, because there is research to show that if your A1C is above 5.6, that damage, permanent damage, is being done to every small artery in your body and to all the tissues and cells and organs in your body. If your A1C is greater than or equal to 6.5, then you're absolutely a type 2 diabetic, or you're a type 1 diabetic and you were missed by your doctor because they didn't check enough lab work. Now, in the UK, New Zealand, and Australia, they measure it a different way. So in the UK, Australia, and New Zealand, you want an A1C that's under 42. That's considered normal. Now, if you have a hemoglobin A1C in the UK, New Zealand, or Australia that is from 42 to 47, sorry, my friend, you're an early diabetic or a pre-diabetic. If you have an A1C greater than or equal to 48, you're a type 2 diabetic. I'm sorry. There are things you can do to improve that and reverse that type 2 diabetes. I've got multiple videos on this channel that will help you do that without having to resort to a handful of medications. Now, the second test that you need to demand lovingly and respectfully from your doctor is a C-peptide. And this is measured both ways, or it's measured the same way all over the world as far as I can determine. But it's interesting that different reference labs and different countries have different C-peptide levels that they consider normal. So in the United States, if you go to LabCorp and you get your C-peptide checked, they're going to tell you that a normal range is 1.1 to 4.4. If, however, you go to Quest Labs to have your C-peptide drawn, they're going to tell you that the normal range is 0.8 to 3.85. So that's odd, right? If you are in the United Kingdom, diabetes.co.uk says that a normal C-peptide is 0.51 to 2.72. So I'm not sure what research they're basing this on, but from just a best guess, an educated guess on my part, your C-peptide needs to be somewhere between 0.7 and 4.0. If you're under 4.0, then you're not pre-diabetic by most standards, okay? Now, that's not 100%. That's just giving you an indication. Obviously, more research needs to be done on this C-peptide level because some labs consider 4.4 or less to be normal. The UK lab considers 2.72 or lower to be a normal C-peptide. The lower you can get your C-peptide up to a point means that you are less and less pre-diabetic or early diabetic. Now, if your C-peptide is super low, almost zero, if it's 0.1, 0.2, or 0.3, then you may be an undiagnosed type 1 diabetic. You absolutely need to talk to your doctor about that and figure out what's going on. Now, if you hate going to the doctor, but you still want to get these labs checked, there's actually a lab company online that you can do this with. I know they do testing in the United States, and they may do it in Canada and other countries too. You'll just have to email them and ask them, but I've got links down in the show notes. It's called truehealthlabs.com, and if you use my link, you'll get a little discount off the lab, and I've got links for the A1C and for the C-peptide. Now, please promise me that within the next month, you will go and either go to your doctor and have these labs done, or you'll contact truehealthlabs.com and get an order, and you can take that order to your local lab and they'll draw it without a doctor's order. Please promise me that you're going to do this within the next month so that if you are early diabetic, aka pre-diabetic, or if you're type 2 diabetic, or definitely if you're an undiagnosed type 1 diabetic, you find out immediately. So you can start to take steps, first and foremost in your diet, secondly in your lifestyle, and then thirdly, perhaps with some medication to reverse your prediabetes or type 2 diabetes, or if you have type 1, to manage it very, very tightly so that you can remain healthy and not have all of the terrible, horrendous complications that come from being an undiagnosed diabetic. If you haven't already done so, please take 1 second and click that subscribe button and the little bell button right beside it so that every time I post a new video, you'll be one of the very first people to know. This is Dr. Barry. I'll see you next time.